Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
My question would be to how to start or be able to open a conversation with clients regarding those older patients and absolutely trying to get those patients treated. And with dentistry, we can recommend. We know that it's needed for every patient. If they haven't had an assessment, we know that there's disease present, especially on those smaller patients. And it's all about client education and hitting some of those key points. We know that the majority of patients under the age or under the weight of 15 pounds have some degree of periodontal disease. And periodontal disease, we know, starts at around 12 to 18 months and can just progress over time. And it's so insidious that a lot of these patients don't show any signs until things are really, really bad. But we do know that they're uncomfortable because when we treat them, and you've all seen this, these patients tend to have much more energy, their appetite's better, they're more playful. So those patients that are a little bit older in age and are sleeping a lot, that's something that everyone assumes is associated with just old age. And a lot of times it's dental disease. And so we really need to educate these clients that we know these patients are uncomfortable. They don't show it. There are subtle signs that sometimes nobody can see because they are so subtle. And we want to make sure that throughout their life and even in their older years, that they're comfortable and that their quality of life is good and that they're happy and pain-free. So that's the biggest kind of info that I give my clients. Dental disease is prevalent and it is painful even though they're not showing it. Ashley sent in a question regarding palpebral reflex, one of the big parameters we use to monitor the correct plane of anesthesia. And this is a really kind of a learning curve. It can be a little difficult to get used to at first. But absolutely, because of the nerve blocks that we're doing, we are able to keep these patients at a much lighter plane of anesthesia. That's the number one reason why we are, is because of the nerve blocks. And if your patients are reacting and having some elevated heart rate or other signs that they're feeling it because they're light, the blocks may not have been affected, whether they're underdosed or just not given correctly, which it happens. So we typically will repeat the blocks because we know that a good, effective block will keep them from feeling anything while they're under anesthesia. We're currently using Nocita, which we just started, that's new on the market, and we're very excited to use that because it consistently gives us 3 days, 72 hours of analgesia for whichever quadrant we've applied that to. So the regional nerve blocks are key, and we want to make sure that we're doing those correctly and that we're using enough volume. A lot of times when the blocks don't work, most folks are way underdosing. So when we do pain management, we'll talk about regional blocks in the upcoming segments. Is from Vero. Do I happen to have a template that is a good checklist that goes over all the things we should be doing prior to, during, and after? I don't. I'm not a checklist person. I've just done this so many times, and I do it the exact same way every single time that I could do it in my sleep. But certainly a checklist, especially if you have turnover in your practice. Our practice, it's been the same staff for about 15 years. I've been with Dr. Beckman about 15 years. And so it is something that's just kind of reflex at this point. I don't even have to think about it. I know that I'm going to induce. I know I'm going to do diagnosis first with dental x-rays. I'm going to start that dental chart quickly with looking at those very obvious pathology rads and get that started. And then I'm going to do my gross examination while Dr. Beckman is looking at the x-rays. We're going to put that chart together, and then we're going to put an estimate together based on that dental chart. And then once we complete that, then it just kind of depends on whether we're going to clean first or do the oral surgery first. But those initial steps, those are the same every single time. And the more you kind of get in the groove, the more you're just going to kind of know the next step. But certainly a checklist of putting all those steps together certainly can be helpful for your staff. Our next question from Megan. Do you have any tips or tricks to get owners to really understand the importance of doing more routine cleanings? I find a lot of owners are hesitant. Do you find it ultimately comes down to finances? It ultimately comes down to client education. And a couple of key points here. Again, we want to get away from cleaning. Cleanings certainly are something that are incidental. Those are going to happen. That's a given. In some cases that we're treating, it can be preventative. But the most important components to any dental program is the assessment and treatment. Assessment and treatment. And if it is a periodontal patient, depending on the pathology that we see visit to visit, that's going to establish our timeline. And our periodontal patients, 2 key points. Periodontal disease, once they have it, they always have it. It is not curable. It is, however, manageable. And the goal with veterinary dentistry is to not clean teeth, but to assess, treat, and prevent, and hopefully prevent tooth loss. That's the big thing. And that's what our owners want. And just cleaning teeth, unfortunately, does not accomplish that. We've seen case after case where folks are very diligent about getting their dog's teeth cleaned every year, and every year we're doing extractions. And so we need to change that paradigm shift and get away from talking about dental cleanings to assessment, treatment, and prevention. That's key. And those, especially with those periodontal patients, because once we get them treated and get them to ground zero, typically we see them every 6 months, sometimes every 4 months, depending on the level of pathology. But the goal is to prevent any further tooth loss as this patient matures throughout its life. So that's kind of the key points there, that we don't really, whatever the crown looks like really doesn't have a lot of bearing on the disease that's going on above the gum line. Certainly once we treat these patients, we want to keep plaque to a minimum, to keep inflammation to a minimum, but that is more preventative. And periodontal patients, we need to see them more often. That is just how we have to handle that so that we can manage it and keep it from progressing. That's the goal.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org. veterinary.org/INV.